Good morning, everyone. Happy Sunday. Welcome to the channel, Shelly's Millions. We've got yet another studio layout. I say studio because now it's really more of my bedroom, and I wasn't planning on making this change, but I one of my biggest money saving tips, money making tips, building your wealth is to actually take care of the maintenance on your big ticket items. Take care of your maintenance on like your dryer, because if you don't clean your lint drawer properly, it can catch your house on fire. Take care of your maintenance on your car, because if you don't take care of your maintenance on your car, you could wind up with a bigger repair further down the road. And take care of the maintenance on your house and your air conditioning system. I don't have a traditional air conditioner. I have a mini split, is what they're called. I have one in my bedroom, this room, and I have one in the living room. And it was time for service, and the bed was blocking the mini split. So I had to totally rearrange this room in order to uh, allow the technician a clear path to actually fix what he needed to fix. Guys, I'm the struggle bus this morning. I worked late night shift last night. Debbie, oh, the little green guy's way back there. I don't know the number one movie. So let's look at it. My regular job is I work at a movie theater, so we normally check the weekend grosses. I'm gonna have a sip of coffee because I have only been awake for about 30 minutes. So yeah. Let me know in the comments if there's a topic that you want me to go over, if there's something specific from Trump's big beautiful bill that you would like me to look at. Um, if you just want to say hi, just let me know over in the comments. All right. And happy Sunday, everyone. We're getting into my mom's. This is like the week before my mom's birthday, and then next week will be the week after my mom's birthday. Her birthday's June 4th. It's also my best friend's birthday, the one that rents the garage from work from home. I might start to lose out on that income because um my friend is going back to the office a lot more now, and they just might not need that room anymore. So I don't know what I'll do with it after that. Maybe that's a good place to put my mom. Okay, let's see here. I want to look at the box office gross over the weekend. And again, happy Sunday. Okay, Alex, we'll get to yours in just one second. Let's look at the movies. The numbers. Oops. Is my computer hot? The numbers. Box office. Okay. What just happened? Numbers. Oh my god, I can't type. All right, let's see here. Okay, so we'll do the 1 through 5 is Lilo and Stitch, which I saw with my mom. It's super cute. Mission Impossible: The Final Reckoning. Maybe I should see that with my mom. We just watched the first one on TV. Karate Kids Legends. One of the things that my mom and I have watched together while she's been here has been Cobra Kai. She really likes that. I hear that the Karate Kids Legends is not really tied into Cobra Kai, but I'd still like to see it. Final Destination, which is horror, so I won't see that. And then Bring Her Back, which I won't see because it's horror. Debbie, I hear that one's really weird, so I don't even know if that one's for you. Hi, Cindy. Good morning. Hi, Sean. Okay, Alex, what's going on with the bill that Trump wants? Is it true? It's going to cut so many people from Medicaid. 20 hours per week must be proven that people worked to get it. Lazy people get kicked out. Let's take a look at the Medicaid portion. I have not looked at that, so we can do that together. Trump's bill, Medicaid. Okay, guys, I am not sure on this. Oof. like, what's a neutral source? I try and look at a neutral source for CNN. Okay, let me take a sip of coffee. Oh, Ernie, thank you, thank you, thank you, thank you, thank you. I was just thinking about you. You'll take a moment out and say hello, and that you hope all the people understand how much care that have subscribed. You've met me, and thank you, thank you, thank you. Yeah, I have met Ernie in person. He was just a subscriber. I mean, you get to I feel like I know all of you. He needed a ride from the airport, and we made that happen, and so it was nice to, like, get to meet somebody in person. Okay, so thank you, Ernie, for saying that. Yeah, I really do care about everybody, right? Here's just, like, a story about work last night. Here's a work story. Yesterday, one of my employees, he hadn't eaten before work, and he was like, "Shelly, I'm really hungry. I want 2 orders of Gouda mac and cheese bites, ice cream, and pretzel bites." And, they get employee discounts on it, right? But it was gonna come to over $21, and I said, "I wouldn't do that. Why don't you, get the 1 order?" And they also get popcorn and soda for free. I was like, "Why don't you just get the 1 order of the Gouda mac and cheese bites, and, instead of pretzel bites, get the popcorn?" And he was like, "Why? I'm hungry." And I said, like, it seemed like I was, like, downselling him, right? And I definitely didn't downsell him, bosses, but I did. Um, because I said, "Look," I said, "Yeah, I care about the theater being profitable, and we care about making money." I said, "But above and beyond that," I said, people being financially responsible is really important to me. That's what I value. I said, "Do you wanna know what I ate for lunch today?" I said, my mom and I had gone to Amazon Fresh. We got a bunch of products that were 75% off because they were, about to go bad. It was a best by date of 5/25. Yesterday was 5/31. So it was, 6 days past its best by date, and that's what I had. I think it was like $1.40 is what the sandwich came out to cost, and I was like, you know, eat less at first and then see if you're still hungry. And, then go from there. He's like, "You're right, you're right, you're right." I'm not trying to make my staff starve, but at the same time, like, $21 is a lot of money. That's more than he makes in an hour, and that's more than he makes in an hour before taxes. So when you look at it like that, I don't know. I discouraged him from buying as much right up front. Um, and he wants to try all the menu items, which is cool. He's a newer employee. But yeah, anyway, because I care. I want people's paychecks to stretch as far as possible. But he was like, "Why are you doing that?" And I was like, telling him. Okay. Oops. Oh dear. Joel says, "I was also reading the information about Medicaid rules if the bill passes. Essentially, you have to prove that you work 20 hours a week. So lazy people in their mom's basement have to get a job." Um, here's something interesting, right? Here's another personal story, right? I like to look at things in terms of things that I'm experiencing. I think most of us do because it helps us to relate. My old coworker, hello if you're watching. My old coworker, he came back to work after the pandemic, and when I say my old coworker, he was my old boss. I've made videos talking about him before. He would be my phone a friend on Who Wants to Be a Millionaire. He's incredibly smart, and he cares a lot about his family. He has been in a position where I don't exactly know the circumstances, but he has not been working because he needs to care for his mom. His mom is getting older, and he's my age, so his mom's my mom's age. My mom's turning 78, by the way, this week. 78 on Wednesday. Happy birthday, mom, if you're watching. Um, my mom is just in the other room, but I don't know if she watches anymore. So he stays at home. He doesn't work, and it is a choice. And he does that in order to take care of his mom. I don't know what he's doing for health insurance. I think he might be getting, complimentary health insurance. So, and I would want like, if I ever had to stop working in order to take care of my mom, like, I would want to do that now. And this is something I've asked my mom to look into in the past, is I've asked her to look into what it would mean for me to be her caretaker, because I do know a lot of people are officially registered as their family member's caretaker, and we did a whole episode on that. It's been a little while. In-home health services, IHHS, is that it? In-home health services. So you can register to be a caretaker for your family member, and then if you're then potentially you would be working 20 hours a week, and maybe he would get some money on top of that. So right now, but see, isn't that money from the government? So wouldn't that actually cost us more if there's people in that situation? Let me know what you guys think, please, on that topic. Would that end up costing us more if there's people in the system? And I don't know how many people this is, right? If there's people who are not working because they're caring for a parent, or or someone like that, or like maybe like, uh, let's just go with a parent. If they're caring for a parent and they're not working, but they're getting Medicaid, and maybe they are living in their mom's basement, while they're doing that. I don't know what the situation is. I know, as my mom gets older, I feel like she wants me to be close, so maybe the parents want the kids in the basement. I don't know. But so maybe now they're not working, but they are getting their health care covered. And then all of a sudden they require that you work 20 hours a week. Would you not just be able to then kind of almost double dip in the system? Wouldn't you be like, "Oh shoot, like I can't work because I'm caring for my parent," and then get registered to actually care for your parent, and now all of a sudden you're taking money from that program um and from Medicaid? What am I missing there? Let's look into it, because I don't know enough to speak on it, but I do wonder about that. Yep, that's what Joel's saying too. I have to dig deeper into what the bill says. I think it's mostly for able-bodied workers. If you're caring for a family members, I believe you won't get cut. Maybe you can find out. Yeah, let's look at that. Let's see what we find, guys. Okay, facts first. This is CNN. CNN fact checking Republican and Democratic claims about Medicaid cuts in the GOP bill. So this seems like it's gonna look at both sides. Okay, take a sip of coffee and we're gonna read the article. Medicaid has become a key hot button topic in the sweeping tax and spending cuts bill that House Republicans are scrambling to pass as soon as this week. Democrats are slamming their rivals for slashing federal support for the Bedrock Safety Net program, while President Donald Trump and GOP lawmakers say they're not cutting the program, at least not for vulnerable Americans. Let's look at each side's claim. Trump has long vowed that Republicans would not harm Medicaid, though they would look to root out waste, fraud, and abuse. After meeting with Republicans and GOP lawmakers on Tuesday, Trump was asked by a reporter whether working class voters who supported him would lose their health coverage. Oh, they won't lose their health insurance, Trump said. And earlier on Tuesday, the president told reporters, "We're not doing any cutting of anything meaningful. The only thing we're cutting is waste, fraud, and abuse. With Medicaid, waste, fraud, and abuse. There's tremendous waste, fraud, and abuse." Facts first. Okay. So, and again, personal story. My grandma, when she was in the hospital, she was no longer walking. She was in a wheelchair. She could have just worn the furry, grippy socks, right? But they would get money for shoes for her. I don't know if she was on Medicaid either, but things like that. My mom is sent so much medicine that she can't even take, they'll send her the wrong eye drops, and they'll send a 90-day supply, so my mom's also not on Medicaid, but there is a lot of waste, right? There just is. Um, so maybe we could cut those things. Have you guys ever I have medicine that I haven't taken. Now, I guess granted I picked up the prescriptions, but sometimes like you're just in a hurry. Maybe you're picking up 3 prescriptions and maybe there's one thing that you're not going to take anymore, but it's just on the list and so you're there to get all 3 prescriptions and you don't want to sit there and not like go back and forth with the pharmacist. Um, I don't know, but I do. I have a counter full of medicine that I never took. Okay, facts first. Trump's claim that people won't lose health insurance from the deep cuts contained in the bill is disputed by a preliminary congre- cong- la- la- la, Congressional Budget Office report and health policy experts. CBO's, that's the Congressional Budget Office, early analysis of the Energy and Commerce Committee's proposals found that 10.3 million people would lose Medicaid coverage after 10 years, though some would find policies elsewhere. Overall, 7.6 more million people would be uninsured, CBO said. The GOP's proposed changes to Medicaid would save nearly 700 billion over a decade, according to an updated CBO analysis released Tuesday. Those savings would be achieved primarily by having fewer people enrolled in the program. Multiple experts from health policy and think tanks have told CNN. The provisions Okay, nope, this always means that I have something to say. So what I have to say is if we're insuring that many fewer people, would it not mean less jobs, less receptionist booking appointments, less nurses seeing patients? And isn't this going to mean, correct me if I'm wrong, it wouldn't this mean that people are going to neglect care, meaning they might arrive at the hospital sicker and you're not allowed to um deny people. Hi Richard, that's what we're looking at right now. You worry about the Social Security and Medicaid cuts. Yeah, so couldn't that potentially make it worse? We haven't seen the other side yet, so let's just keep going. Ba, 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 ba. Okay, the provisions could still change before they are voted on by the full chamber. It's likely that the work requirement proposal would kick in earlier than 2029, as currently specified in the bill, which is expected to add to the number of people who would be left uninsured. Senate Republicans are likely to make additional changes even after the House passes its version. Okay. I'm gonna have another sip of coffee. Now let's look at Medicaid claims from the Democrats. Last week, Senator Minority Leader Chuck Schumer used a figure several of his colleagues have also cited about the impact of the proposed House GOP cuts to Medicaid. In other heinous news for Americans this weekend, the House Republicans unveiled their plan for the largest cut to Medicaid in American history. The largest cut to Medicaid in American history. 14 million Americans, at least 14 million, would be ripped off of their health insurance under this proposal, Schumer said in a press briefing, echoing similar comments by Representatives Alexandra Ocasio-Cortez of New York, and Diana DeGette of Colorado, and Vermont Independent Senator Bernie Sanders, among others. Facts first. The Democrats' assertions need context because their number factors in the expiration of the enhanced Obamacare premium subsidies at the end of 2025. In addition to the impact from Medicaid cuts, the Republicans did not include extending the enhanced subsidies in this package, though it is possible they will do so before year's end. In addition, the Democrats' number includes a provision in the House GOP bill that would codify a proposed Trump administration rule that is also expected to increase the number of uninsured Americans. The House GOP bill would make several notable changes to Medicaid, the public health insurance program for low income Americans. The most consequential would be introducing work requirements for the first time in the program's 60-year history. Certain recipients, ages 19 to 64, who gained coverage through the Affordable Care Act's expansion of Medicaid, would have to work, volunteer, or be enrolled in school or job training program at least 80 hours a month or qualify for an exemption to continue their coverage. The package would also postpone the implementation of a Biden administration rule aimed at streamlining Medicaid eligibility and enrollment until 2035. Such a delay could make it harder for people to enroll in the program and renew their coverage. Plus, it would mandate that states check Medicaid expansion recipients' eligibility every 6 months instead of annually, and require that certain Medicaid expansion enrollees pay for a portion of their care. Okay, have a finger down. That means I've got something to say about this. So, I actually think it's a good idea to check it every 6 months. I think that some people, when they're out of work, right, that's one of the requirements to get on the America Cares Act, Obamacare, is if you've recently lost your job. And Cobra insurance is so expensive. Even if you had insurance through your job, I'm talking like $1,100, $1,200. I'm talking more than your whole unemployment check, right? So incredibly expensive to stay on Cobra. So most people do, if they want their health insurance, which they do, many people need their health insurance, they're going to look for a plan on the Affordable Cares Act, or Obamacare. And a lot of people forget to re-enroll once they're working again, or not re-enroll, but to disenroll, to notify the program that they are working and that they're covered by their employer, and or they forget to update their finances so that adjustments can be made on Obamacare for the price that they're paying, because it's income based, right? There's subsidies. Okay, so let's see what else is in here. Also, I wonder what the exceptions would be. We'll put that into the search bar in a second. Anyway, I would be okay with us checking every 6 months. I think that would help, people when they're back to work remember that they need to take care of that. House Republicans are also calling for codifying a Trump administration proposal that would make changes to the Affordable Care Act enrollment process, including shortening the open enrollment period and eliminating the ability of income Americans to sign up year round. I don't like that because I think a lot of us are just a paycheck away from being low income, kind of myself included, because it's so weird that I'm like, that I can say, and like only in America, right? That I can say on the one hand, I'm a millionaire in net worth, and on the other hand, say I'm probably a paycheck away from being low income. And that's because in net worth, it's the equity in my house, which I'm not going to access until I would sell my house. So that's really, it's not, you can't really count that. And the rest of my money is pretty much more or less in a 401k, which I can't touch until I'm, 59 and a half or retired. Okay. So I don't love that because I think, I'm personally net worth millionaire, one paycheck away from being low income. It's crazy. Rocky says, I'm worried about Medi-Cal. I know many who need their prescriptions because they can't afford them without it. Yeah, I have another friend. Uh, I'm making it sound like I got a lot of friends. And normally I'm like, I don't have any friends. Anyway, I have another friend. Um, love her dearly. She worked in a business and it closed. So she's looking for a job in this market. She starts a new one Monday, tomorrow. So good luck. And congratulations. But she'd been looking for a while. I have another coworker who got let go back in December. Not their fault. They just downsized. She's an old coworker. Um, where she worked, they downsized and they eliminated her position. She's still looking for work and she's actively looking. The person that starts a job on Monday, they lost their old job in February, March, April, May. So it took like 3 full months to find something. And during that time, she's diabetic. And she needed insulin. And I think that she gets like it's I don't know if it's Ozempic or Mounjaro or whatever it is, but it helps regulate your blood sugar. So she was also getting that. That's an expensive medicine. That her doctor decided was best for maintaining her diabetes. It's not for like, "Oh, I just wanna be thin." Like, no, it's helping to regulate her blood sugar. She needs that. Same with like a continuous blood glucose monitor thing. She needs that. And again, Cobra insurance, that's like, I don't who does that? Please, please let me know. If somebody's like, "Oh yeah, I'm just gonna sign up for the Cobra insurance." That's a joke. We could just eliminate that whole program. Who's doing that? Who's requiring that we have that paperwork? Because nobody can afford that. Like, seriously, who's doing that? Have you guys ever received Cobra paperwork and look at how much it would cost for how much? Like, I got that during the pandemic. Even though I'm back with the company pre-pandemic, I got the paperwork and I was like, I can't afford this. I can't afford this. Okay, Richard says, I know quite a few. Oops, come on, show the comment. Okay. I know quite a few people receiving SSI when they're able, healthy adults. They don't want to work. I'm sure that that's true. I'm sure that some people abuse the system, right? I don't doubt that. But are you hurting the many to punish the few, right? Uh, right? Who's keeping Cobra in business? Have you guys seen that? Like, who's affording that? Who's like, yeah, I'm gonna take the Cobra plan? No one, right? Like, who has that kind of money? If they do, like, just get private insurance. I don't know. Okay, the Big Cheese says, my cousin is an Uber driver and he is able to get on Medicaid in California because it's mainly income threshold based. I guess he has to work 20 hours a week, but how is that measured? For self-employed, I'm not sure how that would work. And Uber drivers are still considered self-employed, right? I haven't kept up on that since after the pandemic. Joel says Uber drivers on Medicaid would have to prove they work 20 hours a week, and it would be the active miles, aka when they have passengers, not total online miles, I believe. That would be crappy. It should be like, because I drove Uber, right? And Joel, I know you did too. I feel like it did not have the system very well though, but, like, when we say active mile, you're saying when they have passengers, but there's so many times when I was in my car and I know that they've changed the system because I was back in 2014, and I think now you can accept the next ride, like, before you're even finished with your first ride, but back when I drove Uber in 2014, I would spend a lot of time and I was always trying to this is why I feel like I wasn't good at that and, like, the people annoyed me when they would put their feet all over my car seats in my brand new car, but, um, I would drop somebody off, and then you would say that you're ready to accept a new ride, and sometimes I heard, "Just sit where you are, just park right where you dropped that person off and wait till you get pinged again." Other times, the advice was drive back to a popular area. So, I always felt like when I was driving Uber, I feel like if I parked in front of someone's house, I wouldn't get pinged. I'd just be sitting there twiddling my thumbs, hoping that someone would ping me. And so then I'd get tired of waiting there and not getting pinged that someone needed a ride. So I would normally head back down towards like Santa Monica. So because Santa Monica's busy, there's a lot of tourists, they need rides places. So I'd head back down to Santa Monica, and then you'd get pinged going back towards the house. So I feel like I spent a lot of time driving around with no one in the car, but I was absolutely working or trying to get to a hot spot where I would find more better frequent rides. Um, Santa Monica, by the way, hot mess for poor Uber drivers, at least back in 2014. Like, there's a lot of, like, bus drop-off zones, but there are not, like it's all, like, no parking and red on the sidewalks. So it's like, you're not supposed to pull over to, like, drop people off and pick them up, and, like, taxis and buses, like, they would hate you because your Uber drivers often are, like, pulling over places where you probably really shouldn't, and you're picking up tourists who are not familiar with the area, so, like, they can't really tell you the cross streets, and sometimes you're like, "Meet me in the alley behind the Apple store," and they're like, "Where?" Like, oh god, Santa Monica is a nightmare for Uber drivers. So it's stressful, and a lot of times your car is empty, and totally it should count if you're on the way to get someone. Okay. Joel said it's still kind of like that. The online hours are always going to be somewhat much higher than your active hours. Sometimes you just don't get constant requests. Yeah, I'm sorry. Like, so at the movie theater, my real job, my regular job, um, you clock in, and we have sets, right, at movie theaters. So I was telling somebody it's not like this exactly anymore, but it used to be you had 5 sets a day, roughly around 11, 1, 4, 7, and 10, right? 5 sets a day. That used to be the standard. Now you have movies like Mission Impossible. Guys, Mission Impossible is like 3 hours long. So, you have a really long movie, and so the sets don't always work out, but, like, that's still kinda when people go. 11, 1, 4, 7, 10. Um, but in between, like 11 at 12, nothing is happening at 12. All the movies are in. There's nothing to clean. No one's coming out in the middle of their movie to buy snacks for the most part, unless they're really, really, really hungry. But like most of the time, people are in the movie. And once you're in a movie, you're like not even, you're, if you have to go to the restroom, you're holding it because you don't want to get up and miss the movie. You know what I mean? So, you know, like, movie theaters, we work really hard for, like, 30 minutes, and then there's, like, an hour of downtime. Really hard for 30 minutes, hour of downtime. You're on your feet that whole time, you're ready to help customers, but, like, you don't get customers, but we don't pay people for their active time. We if you're in the building, if you're ready to work, if you're ready to help that customer, that's what you're getting paid for. Should be the same with Uber. If I am there, I'm on the clock, I'm ready to accept customers, that's what should count, in my opinion. Unfortunately, Shelly's Millions opinion on that is not what matters. And Debbie, I would just like to say, if you're watching, I will clean this up. I think I just might keep this layout because the repairman is going to need to get over there again at some point in the future to look at the air. And this is the best layout, but I will clean up the stuff on my bed headboard. Okay. Yeah. So let's see here. What do we want to look at? The Uber drivers, your cousin's an Uber driver on Medicaid. How would Uber drivers, we're going to Google it. How would Uber drivers prove they work 20 hours a week for Medicaid? How about that? That's real specific. Let's see what we get. AI is not always accurate, you guys. But let's see what AI says. Uber drivers who are independent contractors in California and therefore not eligible for standard Medicaid benefits may be eligible for a health insurance stipend under Proposition 22. To prove they work at least 20 hours, they would need to demonstrate their consistent average of 15 on trip. On trip to me would mean with a passenger. Oh, okay, but then 5 hours without a trip? They can do this by providing Uber with proof of their insurance okay, this is weird. Okay. What? Drivers need to enroll in a qualifying health insurance plan. Uber requires proof of coverage for health insurance? That doesn't sound right. Proof of work, 20 hours. This is still AI, which does not seem correct. On-trip hours. Uber uses on-trip hours, the time between accepting the ride and completing it. Wait, what? Does Uber give them a stipend? I don't understand. Okay. Does Uber work with Medicaid? Health stipend benefits. Driving on Social Security and Medicaid. How long does it take to Uber? Prop 22 health stipend. I didn't, what is that? Do you guys know about that? Oh my goodness. Good old claimer popping up. For Trump's bill. And now I have too many words. How would Uber drivers prove they work 20 hours a week for Medicaid for Trump's bill? Sure. Okay, here we go. Is this it? We're going to read the AI and then we'll read the LA Times article and I'm going to have a little sip of coffee. To prove they work 20 hours a week for Medicaid under Trump's bill, Uber drivers would likely need to provide records demonstrating their work hours on the platform. This could involve accessing and submitting data from the Uber app where time spent on shifts is tracked. Additionally, drivers might be required to provide documentation such as pay stubs or other records that verify their earnings on time spent driving. And this is kind of like another thing is that a lot of times you can just say that you're doing something and there's not actually, you wouldn't necessarily have to prove it unless you got audited. So I wonder if it would work like that. Don't lie, but we know some people are dishonest. Don't lie. Right? I'm not advocating that. But how is that going to be checked? Okay. The Big Cheese says, has the movie theater bounced back significantly since the pandemic? I'm already shaking my head no. No, it has not. To be honest, I haven't been to a movie theater in a long time. I should go and support my local business. Please do. A lot of times movie theaters are, I'm wearing a Coraline shirt that I got from the movie theater. Like so much of my life is ingrained in the movie theater. I have like a little, I don't work for Amazon Studios, but I got this at a thing. It's a little, I don't know how it works, but it's a little, like it's a light for my webcam. Is this better actually? Should I light myself? No, because I have my other light, but like a little selfie ring light from a convention that I went to. Like it's, I don't know. Ooh, do we like this? Okay, don't get distracted, Shelly. So should I do that? Some better lighting for me? I don't know. Anyway, so much of my life is ingrained in the movie theater. They have not bounced back after the pandemic. A lot of times Tuesday is a discount day. Debbie didn't like it because she says it's not like enough of a horror film, but I really liked Sinners. There's a scene in Sinners. I'm not going to be spoiling anything by this, but they are playing music and it integrates present day music with very futuristic music and very primal music, and it blends it, and that scene is done just so well. And I really liked it. I thought it was really clever and I thought it was really different. So I liked Sinners. $7, or like discount days normally Tuesday. It's normally like $7. Some places at $5. Please, please, please go support your local movie theater. Please do that if you're able to. I know movies are expensive for some people. When I was a kid, we did not go to the movies like at all. It was too expensive. We got movies at home. We didn't have movies at home. I didn't even have a VCR at the same time like most of my friends did. So we'd go to their house to rent a movie. It was late on movies. Okay. The Big Cheese says, from my understanding with Medicaid, you just get in contact with your county in California and show them how much money you made per month. I don't think Uber actually works with them, but apparently there's some stipend through Uber. Hi, Miss Pretty Lady. Richard says, I haven't been to a movie theater since 1980. I think a lot of people haven't been since 1980. It's expensive for a lot of people to go. But that is what I do, and I love it. And I wish more people would be able to go. And if you just stop by your movie theater, whatever your local movie theater is, and you go in, any employee should hopefully be able to answer this, hopefully. But if you go in and you say, hey, like, I really want to come and support the movie theater. Also, if you just buy popcorn but popcorn is expensive. But if you just want to support the theater, the best way to do that is by buying concessions, which, yes, they are marked up a lot because that's what's funding the utilities, the employees' hourly, the employee's salary. We don't keep a large portion of the box office. That's a conversation for another day. But if you go into a theater and you say, you know what, I really want to come back to the movies again. It's been a long time since I've been. What is the cheapest day for me to go? Or if it's not day, DAY, what is the cheapest way? WAY. I don't know how my enunciation is on the lives. But so yeah, if you ask them what the cheapest way and day to come see a movie at their theater, like they should be able to tell you, any employee. Yeah. Okay. Um, let's see. Medicaid. What are the changes? Changes to Medicaid and Big Beautiful Bill. The AI. The One Big Beautiful Bill Act, a budget reconciliation bill passed by the House, includes several changes to the Medicaid program, including work requirements, increased eligibility redeterminations, restrictions on state funding, and stricter enrollment requirements. These changes are projected to significantly reduce federal Medicaid spending and potentially lead to enrollment losses. Again, this is AI, so I don't know how accurate this is, guys. We would need to fact check this. But work requirements beginning in 2026, able bodied adults, with some exceptions, would be required to work, volunteer, or attend school for at least 80 hours a month to maintain Medicaid eligibility. Guys, I don't know, a pet shelter. Maybe you could volunteer at a pet shelter. The provision is projected to save billions of dollars by reducing enrollment and potentially shifting the cost burden to states. Okay, that's important too. That if that's accurate, the provision is the cost benefits to states. So would the states come in and supplement if Medicaid didn't? I think that possibly that could be a thing. Matinee. The Big Cheese says, I'm sure I spelled that wrong, but isn't that cheap movie time? It's literally the middle of the day on the work week. Yes. And it's called there's normally a bargain matinee, but they've like peeled the hours back on that at a lot of theaters. A lot of theaters is just the first show of the day, and some theaters still go as early as 10:30 a.m. So I don't know who's out and about and at the movie theater that way, but most movie theaters have like a whole day now where it's a bargain rate. A whole day. So like all day Tuesday or all day Thursday or all day. It's not normally like on a weekend day because that's when people are out and about. Wait, who didn't like to be known as Taco? Rocky. Was that for us? You need to go back to the movies. You miss those days. Yeah, please, everybody, come see a movie. Please find your local theater's discount day and go on that day. Okay. All right. Back to the work requirements. Okay. So it potentially, okay, it says the provision is projected to save billions of dollars by reducing enrollment and potentially shifting the cost burden to states. I do think states would step in, and I don't think that they would let people be uninsured. Also, guys, just want to let you know I might need to step out a little bit early today, so I might be wrapping up soon. Um, Two, increased eligibility redeterminations. States would be required to redetermine eligibility for Medicaid expansion populations more frequently, every 6 months instead of annually, which could increase administrative costs and potentially lead to enrollment losses. Or, um, yeah, like if you were suddenly employed and you were getting this, but then you don't need it anymore, then there would be enrollment losses. Restrictions to state funding. The bill would limit states' ability to finance Medicaid through provider taxes, potentially impacting states' budgets and access to care. It also restricts the use of state directed payments, further limiting state flexibility in funding Medicaid. But would they figure out, like, would most states figure out another way to fund the program? I don't know. Stricter enrollment requirements. The bill includes measures to streamline enrollment processes and reduce the number of individuals on Medicaid by increasing the frequency of eligibility redeterminations. It also introduces stricter documentation and verification requirements for enrollment. Reduced retroactive coverage. The bill would reduce retroactive Medicaid coverage from 90 days to 30 days. Okay, so if you became unemployed and you saw a doctor and you didn't have health insurance, it wouldn't go retroactive to 90 days. It would only go retroactive to 30 days. I think that's okay. I think, employers, if there's like a, change in relationship, should just really remind people to get on it if there's a change in their status. Okay, potential impacts: increased enrollment losses. The combination of work requirements, more frequent redeterminations, and stricter enrollment requirements could lead to a significant decrease in Medicaid enrollment. Impact on vulnerable populations. The changes could disproportionately affect low income individuals, people with disabilities, and the elderly who rely heavily on Medicaid for health care. Increased uncompensated care. Some hospitals and providers may see a rise in uncompensated care as Medicaid recipients lose coverage to changes. Yeah. And then if they're footing the bill and they're not reimbursed, like I don't know if that's actually going to be better. State budget impacts. States may face increased cost to administer the new requirements, while their ability to fund Medicaid through provider taxes and state directed payments is restricted. All right, guys, I'm going to hop out pretty soon. W says, I feel like these changes in Medicaid is just going to cause people to die or get more sick. I don't want them to make changes. Yep. My mom's doing well. Her birthday is this Wednesday. Thank you, Sean, saying happy birthday to my mom. And Cindy says Indiana has already talked about cutting Medicaid. The state is projected to take in $2 billion less than expected. It's due to losing federal programs imposed over COVID period. So, Cindy, I'm curious, are you in favor of them cutting Medicaid? Because are they losing the $2 billion because of those cuts? Because also, like, some people do still have to pay a portion, but if less people qualify, I don't know how that's gonna interact with things. All right, guys, I have to head out, so let me know what you think about that in the comments. Have a great rest of your day. Happy Sunday. Thank you for watching Shelly's Millions.